Good morning, I'm Clarice Pimentel, student nurse of Riverside College. So today I will be performing the open gloving technique and draping. So I will proceed to the open gloving. It is to prevent transfer of microorganisms from hand to sterile objects or open wounds. So before I start, I will wash my hand using antiseptic solution and dry sand. It removes bacteria from skin surfaces and reduces transmission of infection. Gloves are easier to wear when hands are dry. Place sterile glove package on clean, dry surface above waist level. Moisture could contaminate the sterile glove. Any sterile object held below the waist considered contaminated. Opens outside wrapper by carefully peeling the top layer back. Remove the inner package, handling only the outside of it. This maintains sterility of gloves in inner pocket. With the thumb and forefinger of non-dominant hand, grasp the folded cuff of the sterile glove for dominant hand. Unsterile hand only touches inside of the glove. Outside remains sterile. Lift and hold glove with fingers down. Make sure it does not touch any unsterile objects. Glove is contaminated if it touches unsterile objects. Carefully insert the dominant hand into glove and pull glove on. Leave cuff folded down until the other hand is gloved. Attempts to turn upward with unsterile hand may result in contamination of sterile glove. Holding thumb outward and slide forefingers of gloved hand under cuff of remaining glove and lifts glove upward. Thumb is less likely to become contaminated if held outward. Carefully insert non-dominant hand into glove. Adjust glove on both hands, touching only sterile areas. Sterile surface touching sterile surface prevents. So now I will proceed to the draping. It is to isolate the perineal and rectal area from the rest of the body surface from contamination during delivery and other obstetric, gynecologic, and surgical procedures. So, check the availability of the sterile drapes. Is able to identify drapes to be applied arranged from top to bottom. So, first is one buttocks sheet, two leggings, and one abdominal sheet. Securely and properly places patient in lithotomy position. So insert both hands on the pocket fold provided in the buttock sheet. Remove sheet from the table. Adjust one-third and two-third portion and apply to the buttocks of the patient. So, instruct the mother to slightly elevate buttocks and insert the buttock sheet underneath, then remove sand immediately. So, ma'am, pwede lang ito makasi ang bulit, ma'am. So, as if na si baby, sir. So, identify which leg of the patient is near to the sterile table. So, the leg of the patient is near, the right leg of the left leg of the patient is near to the sterile table. So, leg near the sterile table should be draped first to protect the table from contamination by the leg of the patient. So, insert both hands in the triangular pocket fold provided on the legging according to the leg of the patient that is near the sterile table slightly flaps. This facilitates the entrance of patient's leg into the legging while maintaining the sterility of the hands when applying. dapat hindi magtandog ang uning area sa legs ng patient. So, ipasulod lang. So, able to perform the same step in draping the other leg. Ensures that the scrub nurse is positioned between the thigh of the patient to provide safety of the baby if imminent delivery will take place. So, pasulod lang. Next, insert both hands on the pocket fold provided on the abdominal sheet. Adjust drape into 1/2 portion. Remove sheet from the sterile table and places over the the patient's abdomen. Is to provide sterile surface on the patient's abdominal area for the baby after birth or during other obstetric, gynecologic, and surgical procedures. Instruct the mother to place both hands on her side, not to touch the abdominal sheet. It is to maintain sterility. So, last, I will perform the removing gloves. Using dominant gloved hand, grasp other glove near cuff and removes by inverting it, keeping the contaminated area on the inside. Continues to hold on to the glove. Next, slide fingers of ungloved hand inside the remaining glove. Grasp glove inside and remove by turning inside out over hand and other glove to minimize contamination of underlying skin. Last is discard gloves in appropriate container and wash hands to reduce the spread of microorganisms. Thank you.